of a very selective audience of community leaders. In the wake of a sudden spike in the number of COVID-19 positive cases being detected across KSA in the recent days, Abeer Medical Group would like to extend a warm welcome to each one of you to today's conference titled We Are All Responsible. It is an initiative to reassess the role of the community leaders to combat the coronavirus pandemic and to take necessary action to flatten the curve. To begin today's proceedings, I would like to welcome Dr. Ahmed Alungal, Executive Director, Abeer Medical Group, for the welcome address. Dr. Ahmed Alungal, for the welcome address, please.
Hello everyone, Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I'd like to thank you all so much for taking time out and joining this initiative. We are all going through a very different kind of a crisis in our lives, like no other in the history of mankind. Every day we witness the increasing number of cases around the world, and I'm sure not a day passes by without thinking of the good old days. Not that old enough though, at least 3 months back, when we all had we had all the freedom in the world. Many of us are directly in contact with cases in helping them avail the best treatment possible or supporting the community in some or the other way. Fortunately, we see that even during an increase in the confirmed cases in the kingdom, there is an equal or more number of recovery cases that are being recorded. And it is of great relief for us that the mortality rate in KSA and generally in the GCC is way below the global percentage. There is less than 1%, to be precise, around 0.5%. That is what is in KSA. And also the number of critical cases are very less. We see that even in the press conference with the health minister, there were remarks that the most of the ICU beds in government facilities and private facilities are still vacant. That is actually a huge ray of hope for us. And definitely for this, we have to thank the robust and the dynamic health system that is prevailing in the kingdom today. With that being said, I cannot go further without thanking our guest speaker today, Dr. Bilquees Shoukat Khan, who is the Assistant Coordinator of the Department of Preventive Medicine at the Ministry of Health, Jeddah region. And due course, we are also expecting a few more speakers from MOH and other government organizations, especially in the sector of preventive health, public health and infection control. So they'll be able to give us a more broad view regarding what is a community role in this outbreak. But again, because of the busy schedule, many of them had agreed, but they are not able to make it up. So as and when they'll be able to join, we'll include them, inshallah. Again, I would like to thank you all for coming in such a short notice, which itself speaks high of the importance of community engagement in preventing the spread of COVID-19. Today, we shall share and discuss various ideas on how the community and you as the leaders from this community, representing a large variety of expatriate population in the kingdom, can help in this battle. As time permits, we shall have a question answer session towards the end of the talks, where we request you to discuss issues related to the agenda with our panel and utilize the session and do our best to spread this message amongst our communities as much as possible. Without further ado, Pastor Dr. Abdurrahman, please continue the proceedings. Thank you all.
Thank you, Dr. Ahmed, for the welcome address. We now move on to the topic of the day, the theme presentation on the community leaders' role in curbing the pandemic. And the presentation is titled as We Are All Responsible. I welcome Dr. Jemshith Ahmed, Vice President, Strategic Planning, Abeer Medical Group, for the theme presentation. Dr. Jemshith Ahmed, please.
Assalamu alaikum, everyone. Good afternoon to all the community leaders and the participants of this webinar. We'll be going ahead with a small presentation that I've prepared. Before coming to that, the title of the topic we are discussing today, We Are All Responsible. You know that the world is at war. There is a battle going on, and the war is against an invisible enemy, the coronavirus. So gone are the days where this battle of illness is limited to an individual or a family or a small community. Now this is a global war. So we as community leaders and communities have to take on the responsibility. Sharing the presentation slide with you. Right. So the title, We Are All Responsible. This was a slogan coined by the Ministry of Health in mid of March 2020, right after the outbreak happened in Saudi Arabia. We know that the first case was reported on March 2nd, and towards the middle of March, this slogan was released. I cannot think of a more apt slogan because it's not responsible for a patient or a healthcare sector or the economic sector or a particular ministry. In this war, we are all responsible. If you look at the other campaign slogans like stay at home or break the chain or circuit breaker that they have adopted in Singapore, this one, like we are all responsible, outlays all of them, and that is the topic that we're going to be discussing today. Now, there is a common saying not to miss the forest for the trees. Now, when we look and think in our spectrum or in our sphere of influence, whether it be our family, our community, or our country, we generally tend to miss the overall picture, what the scenario is going on outside of that. So it's very important in this attack or in this pandemic to address the situation on a holistic view. So zoom out, let's understand from the top what are the things happening, and then we'll be able to find out a better solution to address this. Now, during the talk, I'll be taking you a little bit of the current statistics. What are the measures we have taken so far? Where is the missing link in terms of Saudi Arabia, in the measures not implementing on the ground? What are the missing links? What are the expected next set of measures due to be rolled out by the government or the healthcare authorities? What can we expect? Obviously, this is an estimation based on best practices. What is our role as a community? How can we help it? How can we get involved in this? And what is the purpose of this meeting or this gathering, and how all we can contribute and raise a common platform to help the efforts of the government? I'm sure you're aware of this chart, which just shows the daily increment day by day. And the last couple of weeks have been really good numbers or high numbers for us, 2,000 plus, 2,500 plus daily. And we are all monitoring this very eagerly. Although I would want to stress the fact here that minimal variation between the days is not of significant value, and we don't have to be tensed or panicked about a small increase or a small decrease, because the general pattern or the trend is what we should be concentrating on. Now, I'll show you two more charts which are not generally discussed and shared. Now, you'll find the top 15 countries in the world who have the corona pandemic, or the numbers in terms of numbers. And if you look at the prevalence, which is the number of patients or number of positive cases divided by the total number of population, you would see Saudi Arabia with 0.17%. So that's a very small percentage when you compare the others, where you have 1.18 and 0.60, 0.717 is still a reasonable number. Now, the level of penetration of the epidemic into a country depends on a lot of factors. It depends on the population density, depends on the humidity and the environmental conditions there, the prior immunity level of the people living there, the healthcare practices, the hygiene practice. A lot of multi-dimensional elements come into play. So it's not one single factor. And so far we have been able to be under control there. Now, what everybody is mentioning was the mortality rate. If you compare the number of deaths against the number of people affected, You'll see all the skyscrapers in other countries where you'll have a very small tower of 0.56% in Saudi Arabia, which is a very optimistic value. Now, we touched upon the possible reason for this, one of it being a very good healthcare infrastructure with good doctors, good ICUs and ventilatory management to affect and cure all these patients. Now, I would want to propose here one other element which might be of interest to all of you. Now, there is something called a population pyramid. Now, the population pyramid just breaks down the total number of people in age bands. So if you look at the 0 to 4, 5 to 9, the readings on the left side of the axis or on the y-axis, you will see the age bands. And I've compared 3 countries, United Kingdom, France, and Saudi Arabia. If you look at United Kingdom and France, you would see a tower, the shape of an Empire State Building, where it's very flat on the sides and tapering on the top, which just says that there are a lot more people on the top as well, aged population or the aged community. So if you look at the mortality rate in these communities, it's largely affect the people above 50 or above 60. So that is where that number or the death mortality is coming in. If you look at the Saudi picture, the population pyramid of Saudi, you will see a small type shape with the curving sides and the tapering there. So this is a young population. Saudi Arabia has got a young population with a wider base. So young population, ballooned at the center, middle age, and then tapering very rapidly at the top with less people of elderly. So this could be why the mortality rates is lesser in some countries and why it's more in others. So we are doing a small study in Abeer to take this data for all the countries affected and to see if there is a correlation between the population pyramid and the mortality rate. We'll release those results and we'll be sharing with all of you. Now, to have a picture or an idea about the healthcare environment or the healthcare infrastructure in Saudi Arabia, these figures, the chart you see on the right are figures from 2016, and the one on the left are updated figures in 2019. So for any community or any country to deal with this situation or a pandemic, you need to know what we have at hand. So the number of hospital beds put together with private and public participation, obviously the majority is in public, which is 75%, 1,000 beds, hospital beds. Now we're talking about all the licensed beds in Saudi Arabia. We know that we also need these for the regular cases like gynecology, oncology, and all the regular cases also need this. So this is the bed strength that we have. Obviously now government opened up field hospitals and extended the capacity of some of the hospitals, but these are the documented numbers. 75,000 is the bed capacity that we have. We have around 100,000 licensed practicing doctors working in Saudi Arabia and 200,000 nurses. When you compare with the other GCC countries, obviously Saudi has a very high of these facilities. So far, and the statements given by the Ministry of Health saying that we still have capacity, we still have critical care capacity. So that is a good sign for us, but we don't want to test the system so far. We don't want to be contributing to increasing, making more stress or load on the healthcare system. That is the purpose of this meet. Now, overall strategy for any country, I'm talking only about the healthcare side of it because we being in the healthcare segment, I want to concentrate on the healthcare aspect of this. The medical aspect are 3-pronged attack. One is obviously to minimize the number of positive cases. This is where all your physical distancing or social distancing, hand hygiene measures, isolation, reverse isolation, quarantine, reverse quarantine, barrier controls, all these things are minimizing the number. The second part is the minimize the mortality rate. So somebody gets affected, what is the best treatment you can give them? What is the best facility that you can provide for them? And how do you make sure that they survive this ordeal? This is the second line, which exclusively at the hospitals or the healthcare facilities. And the third one, which is the larger level planning on in case the numbers increase further, how do we further improve the healthcare segment or the healthcare sector? Increase number of beds, recruit more healthcare professionals, etc. is the third element. So what we're concentrating as a community here is on the element of minimizing the number. That is where the community and us in general have a larger role to play. The other two are dedicated for the healthcare segment, health ministry and the government officials to take care. But we have to concentrate on the number. And we will come to how do we do this. Now, in terms of what we have done so far or what Saudi Arabia as a country has done so far, I'm sharing you 2 slides. If you look carefully, the left top slide is on the time span is January 30th. That is right before we had a case, even a single case of corona If you look at the color coding on the left side, Saudi Arabia is shaded as the teal color or the bluish green color. So we had started effective information, public information campaigns in a coordinated way in Saudi Arabia, effective Jan 30th. The gray countries you see have not started anything on that sort. So we have moved ahead. Saudi Arabia has started earlier. The right side top one is on the restrictions on internal movement, where we, Saudi Arabia, imposed on March 8th, where you see the rest of the world have not even started anything in that aspect. So all these measures, lower down is school closures and workplace closures. If you look at the date in which Saudi Arabia has started as public health measure to initiate these steps, which is the best thing, and the first country is one of the first countries to do it. Saudi took the initiatives, and we appreciate the Ministry of Health and the government to taking these initiatives. One more slide further justifying the same findings: cancellation of public events, controlling all international travels and closing the borders, workplace closures and stay-at-home campaigns. All these, we were one of the first countries to implement it from day one, or the way word go. So this has tremendously influenced the numbers that right now we are seeing. If we had not done these, obviously the numbers would have been really much higher. So we have done all the right things and checked all the right boxes to make sure that the country is safe. Now, this is a summary slide of all the government response stringency index. So all the parameters that we saw in the previous slides put together, this is the current snapshot of how effective or how stringent the government is in pursuing the measures advised by the WHO. You can see Saudi Arabia right in the center there, which is a deep yellow or a violet, if you could call it. So nearing 100, nearing 90% or 90+%. So that is the level of measures that the Saudi government has put in to combat this. Now, when we look at all this, Saudi was one of the first players to implement all these measures, and still we are seeing an increase in numbers now. Now, I'm sure there is, you're all thinking that there is a missing link, or there are some barriers where this effectively has not penetrated on the ground level. So we are here to try to analyze what are these barriers and how can we, being closer to the community, take effective measures to get this across on the ground. Now, these barriers are social because we have different environments of living, we have different work habits, different social habits, etc. Language barriers are one reason where government is issuing most of the directives in Arabic and English, although there are campaigns of SMS campaigns on multiple local dialects as well, like I've seen Hindi, Urdu, Malayalam, Tamil and all coming in. But to further penetrate and emphasize it again and again, it is for the community leaders to take it up. Now, legality was once concerned of illegal immigrants and workers here, but the government and the king himself has taken that into control, where they have legalized. So anybody without a document also, you get full rights of treatment. Access to healthcare in some of the remote areas and all still is a problem because transportation facilities are limited. We have had multiple people calling us saying that I'm sick, but I cannot have the transportation to be visiting a healthcare center. That is one area where we could see some sort of a community sourcing of transportation facilities for these patients. And for me, one of the other barriers is the inertia to change. So we have campaigns running about no smoking and wearing a seatbelt all the time. Although people recognize the importance of these measures, there are some people who have this inertia to take on the habit and come on board. So this is where we have to play with the mental psyche and the psychological impact or the aspect of people of why it is important for them to follow these measures. Right. Now, if we speculate on the way forward or expect what are the things going to come in the near future, the picture you see on the background is a recent photograph from Japan, where they have started opening up the community, where you see everybody with the mask. So we are going to see some real changes happening in the way we live about, but this is the way forward. Government always has to balance the economic side of the story, the earning capacity of the people, the spending capacity of the people, as well as the health benefits. So we are expecting a phase-wise relaxation of curfew. It could be sector-wise. It could be, people with odd number, even number, a comma coming out on alternate days. It could be based on age, where people below the particular age are only allowed to come out, more than 50 or 60 stay at home. So some way of phasing out the relaxation would be coming in. We know that next 4 days of Eid or 5 days is complete curfew. After that, we are expecting this to come in. The other thing, even if we open up shops and schools and all that, there would be mandatory health screening for somebody to enter a premises. A mandatory temperature check at least would be there. And then I was hearing from a friend where they are now opening up in Malaysia, where you go to a hotel or a restaurant, you're supposed to register your phone number there. So which is indirectly being tracked on how many people are there at a time in a restaurant and where are these people going. So we might have to give up some of our privacy aspect where you register and government has the facility to monitor your movement. This can be coming up. Businesses and schools, we have seen that opening up in some countries. Obviously, we expect it here, but with precautions and general guidelines will be applicable. Now, reverse quarantine, we have all heard of quarantine is keeping aside a suspected case or somebody who's susceptible to get the infection. Reverse quarantine is the reverse where you quarantine healthy people. So reverse quarantine would be for elderly people or people with diseases where we put them in quarantine at home or special isolation centers, and the rest of the community can come out. This might be one of the strategies or the tactics. Social gatherings would be definitely allowed in small, we have seen 5 and 10 gatherings which are approved now. That numbers will slowly increase. This is why how the community will come back to track. Strengthening the healthcare system will be one process where the government will be concentrating on. We have seen that huge allocation of budget resources for the healthcare segment. All the projects in healthcare segment are going on. So increased capacity of beds, training facilities, education facilities, and government is already spending. So this will be one area where the government is doing it. Vaccine is under development. We are expecting 1 to 1.5 years or maybe 2 years before a vaccine comes in. But I'm sure once a vaccine is released anywhere, Saudi government will be one of the first countries to get that access to all the community here. And then the concept of herd immunity, where people now are moving out and mingling. Slowly, the healthy people, once they get infected, they will develop this herd immunity. So these are the possible steps, studying from other practices of other countries and WHO guidelines, what our country also would want to look at. So are we ready for this? So this is what we have to expect in the coming months. So we have to be ready for this. Now, coming back to the role as leaders, I know that I'm speaking to maybe 60 or 70 or 100 people among you, but we want this information to be radiated out or propagated out to another into 10 or into 20 or into 100, depending on your sphere of influence. And we want this information to go out. One of the problems that we are facing is what WHO has coined as an infodemic. Now, there are a lot of information in the public domain regarding prevention strategies, mitigation strategies, and control strategies of COVID, but some of these are not genuine. Some of these are not right. So as community leaders, we are part of WhatsApp groups or Facebook groups or other social gatherings. So we have to take it our responsibility to spread only the right news. So some news comes in. As leaders, we have to be the filtering agent there to spread out the right information to the right audience. Protecting vulnerable groups is another strategy which leaders can emphasize on. We know the vulnerable groups, which is elderly population and people with comorbid illness like diabetes, hypertension, or any other physical incapacity. So these people should be carefully assisted, and people who are co-living with them, young people who are co-living with them, should be specifically asked to be cautious. If possible, move out of them, leave the parents alone or the elderly alone at home, because if you're going outside, mingling with the community, bring back the infection, you might not be affected. It will be the elderly or the vulnerable groups that be affected. So this message has to come out. Now, physical distancing, we said that the community is going to come back to normalcy, but this involves a new habit or an arrangement. Now, we had a lot of people ask us about labor camps on places where people are crowded or living together. Let's say a room where 10 people are living together or 8 people are living together. 1 or 2 of them show symptoms. It's difficult for the others to isolate. I think as community leaders, we can have some solution where there can be community isolation centers. So one of the accommodation facilities can be converted as a community isolation center where all these symptomatic persons can be moved there. This needs support, this needs funding, this needs logistical support as well. But I'm sure with the support of the corresponding embassies and consulates and other associations, and Abeer can also pitch in, we can do this happen. So this is where the habit change, the habit of wearing masks, the habit of washing your hands constantly. There are places where public hand wash stations are installed in crowded areas. So let's say an area like Sharafia or Balad, or where people gather in the evenings, we can have community hand wash stations put there. So these are some of the initiatives that community leaders can take in. Right. The other aspect is, how do we prevent this? How do we make ourselves ready that even if we get it, how do we tide over this? This is to boost immunity and to promote good health practices, where Abeer as a healthcare provider can play a larger role. We'll be supplying documents, pamphlets, and education materials to all of you in your native language, so you can take it up and promote it to your community. And the million-dollar question, or the solution that we are all looking for, is to reduce the R number. Now, most of you who are reading these stories know what is an R number. This is the reciprocation number, or the replication number, or the reproducibility number, which is the number of people infected from a single person. So right now, I think the COVID number is around 2.2 to 3 in different countries. The flattening of the curve will happen only if the R value comes below 1. So which means if I get infected, should not pass it on to more than one person. Then only the numbers will start coming down. Till then, you will see this increase going on. And this will be achieved by your hand hygiene, mask wearing, and other etiquette measures that we just mentioned, and isolation procedures. We have seen these habits change. The greetings that we see on the top left, which is the usual way of greeting, it can be a hug, it can be a kiss on both cheeks, etc., has now gone on to be a simple namaste or an adab or a foot kick is what we have seen now. This is what some of the future is going to look like. This is an examination being conducted in Vietnam for high school students with proper spacing facilities allowed. We have seen pictures of kids wearing masks and shields to schools. So this would be something we'll have to live with, we'll have to adopt to in the near future. So this is the mindset we want to develop in all the community members. Already we have started working from home. We have adapted ourselves to working from home. So you're formal on the up, and you can work regularly like this. Now, to the last slide, I'll be concluding soon. How can Abeer help, or how can this platform play a role in this? I want to re-emphasize one more thing. There is a lot of other aspects like the economic side and the poverty side and all that. I didn't concentrate on that because there are other bodies to take care of this. And also, so far what we have seen, all the associations in the communities have been concentrating their efforts on relief measures of providing food, providing shelter, providing transportation, repatriation programs back to their home countries, attending to the needs of the people who are affected directly. We want to slightly have your time span and your focus of attention also given. I wouldn't say completely taken out and given, also given to the preventive aspects of this. This is where the main message of this is we are all responsible in combating or reducing the numbers. So Abeer will, there will be a number which will be sent to you again by WhatsApp with all the details there. We have opened up a WhatsApp number for a fact check. So I personally, and some of the doctors here personally, are getting messages where, doctor, is this true? Is this treatment true? And we are clarifying for them the right way. So if you have come across any message or any publication that you want to be checked for the genuinity, you can please forward this to the number, and we will do the homework and get back to you with the relevant information. We have already done a lot of educational tools, educating people about the hygiene practices and best practices in different languages. So we'll be sharing with you, and you can also put up a request in your language and we can make it done. We can do it and give it to you. We are always ready to arrange for webinars and seminars, Zoom webinars and conferences where our doctors can speak to you. There could be a large labor camp of population of 10,000, 20,000 or whatever. Our doctors can come on the virtual interface and talk to them and cure their doubts, if any, in that sense. Now, one of the other aspects is the large level of stress that the people are facing. The fear of getting an infection, the fear of what will happen, the uncertainty of the future, the panic behind losing your job. There are a lot of stress factors coming in. So medical help would be needed for some of this. We have heard of instances where people are going to the extreme step of suicides and all that. So we would have counseling sessions by dedicated professionals who can address this. So this can also be brought up to our attention, and we can do our help in whatever way we can do. The fifth one, we said about masks. Wearing a mask is going to be the norm of the future for at least 6 months or 1 year time. So we would be giving you do-it-yourself guidelines for preparing masks. We have seen a lot of masks being sold in the local market which doesn't meet the necessary criteria, and instead of protecting you, it might be even harmful for you. So we will give you guidelines on how to do a mask. As community leaders, we can give this message to people at home, maybe women who are not working outside, they have a talent in doing stitching. We can get this done from them, and this needs to be supplied free of cost if possible, and the habit to be created by the community to make sure that one doesn't spread to another person. Now, the other thing is to combine this effect. You must have noticed that this is a multicultural, multinational, multilinguistic community group that we are having. So this fight will not be won by any single community or any single area or any building. So unless we all go in it together, a country faces it together, we won't be able to succeed. So best practices, you must have done a lot of interventions in your community. Please share it with us. We will share it with the other community members and we'll make a story out of it. And we will showcase what is the best practice to be followed by all of us. Thank you all. This is, thank you for your patient listening. Once again, stressing on the fact that we are all responsible, not only to mitigate the effects of the infected virus for the people who are affected, but also to prevent. Now, this aspect needs to be stressed on further. We have to act in unison to make sure that the R value stays less than 1. Thank you very much. I'll be happy to take questions at the end of the session. Thank you.
Thank you, Dr. Jemshith Ahmed, for this wonderful presentation and addressing the most important topic of what a community leader must do at this challenging time. We shall come back with question and answer session after the next speaker. Next, we have a guest speaker amongst us. She's going to speak on managing the pandemic from an infection control perspective. Please join me in welcoming Ms. Bilquees Shoukat Khan, Department of Preventive Medicine, Ministry of Health, Kingdom of Saudi Arabia. Ms. Bilquees Shoukat Khan, Department of Preventive Medicine, Ministry of Health.
Hello, assalamu alaikum. I hope everybody can hear me.
Yes.
Thank you for inviting me to this webinar, firstly. And it's a very nice initiative that you've taken to get people from different communities together so we can share our perspective, okay? The message from Ministry of Health has been very clear since the beginning, and it's very nicely summarized by the previous speaker over here, giving us the statistics and what the message has been. Message from our side has clearly been, as you mentioned, all of us are responsible. And of course, as you said, after Eid, we are expecting to see, shops and businesses starting to open. They've already opened up for a period of time before the first day of Eid. And I was outside on Tahliya actually, and I saw a bit of a crowd over there. But I also saw that people were wearing masks. The shop owners had made arrangements that everybody was triaged, checking the temperature and providing masks and gloves if people were not walking in with them. So these are measures, I think, which will continue for another 6 to 7 months, and it's very good. People should not be hesitant to follow these precautions. And another very important thing is that to minimize going to crowded areas, just go for necessity purposes. And if you do have relatives in the same city you're living in, try and minimize your meetings, because this is a temporary phase also, even though we're going to be waiting for a vaccine, as you said, for maybe 1.5 to 2 years, but still, I mean, there's always hope. And it's not necessary that you're going to be distancing from your family or your relations for extended period of time, but you have to be sensible, be smart, be sensible. If you are meeting somebody in their home, make sure you have face masks on, because you could be an asymptomatic carrier, as you mentioned over here. And it's not necessary that the person in front of you has a very good immune system. They might just develop symptoms and full-blown COVID. And you, on the other hand, could be an asymptomatic carrier and recover without any symptoms. So these are measures which are going to be necessary for maybe for the whole year to come. And as you mentioned, developing new habits definitely have to be practiced. And these new habits would be, hand washing and being careful when you go out for grocery shopping, for any purpose of buying, when you are meeting somebody, when you're going to the banks, when you're going to any of the supermarkets, make sure there is distance between you. If people in front of you don't maintain distance, you can take a step back, protect yourself, keep yourself safe, and make the initiative to protect the other person also from you, because you could be an asymptomatic carrier at that time, okay? And so these are basically the same thing. Stay at home as much as you can. If you need to go out, but just take the necessary precautions. Just take the necessary precautions, which are very easy to follow, which are very easy to follow, and they have been passed on. It would be very helpful if Abeer can get the information out in the different languages, all right? Because I think there is a huge sector in our community that does not follow Arabic, that does not even follow English, and a lot of the labor community, they need to be educated as well. A lot of the labor community needs to be educated. I think consulates would definitely help in this respect. If we can have the help from different consulates in making out safe information in their language and distributing it to them, that would be very helpful. All right, and basically this is what Ministry of Health is trying to do, is trying to educate people on how to minimize transmission, okay, how to keep yourself safe and how to keep others safe as well. And of course, things are going to be opening up. It is not possible to shut down the entire country or society for a year, for 2 years. We are going to be opening up, but slowly and gradually. And as you re-enter your social life, you re-enter your work life, just make sure you have the precautions on hand. Be safe and do everything to protect the person next to you, or in front of you, or around you, or in your workplace, or even in your home. Thank you very much for this invite, and I hope we can clear out some of the misconceptions in the end during the question and answer session.
Thank you, Dr. Bilquees, for your valuable thoughts on managing the pandemic from an infection control perspective. We move on with our next part of the program, which is the question answer session. I'm sure most of you will be having a lot of thoughts, a lot of questions which is unanswered. So we are more than happy with our panelists, Dr. Ahmed Alungal, Dr. Jemshith Ahmed, and Ms. Bilquees Shoukat Khan from Ministry of Health, who shall answer to your queries. What I request the attendees, and we've got a very wonderful set of people. It's a great reunion, as somebody said in the beginning of our program. Somebody messaged in here saying that it's a great reunion. It is indeed a reunion of community leaders and the media fraternity and healthcare professionals. We're also happy to welcome members from other nations like Philippines, Ethiopia, Pakistan, and of course India, and most importantly Philippines. Right? Thank you so much for joining in, and we shall now move on to the important session, which is the Q&A. So, how do we follow this Q&A? Since we cannot unmute everyone together, what I request is you can raise your hand. Okay, if you are aware how to raise your hand, go to the participants column and say raise hand. Okay, so accordingly, we shall unmute from our IT desk, right? So if you're aware how to use the Zoom application, okay, for those who are not aware, I'm just quickly informing to you, on your bottom screen, there is participants, right? In participant, click on participants. Once you click on participants, you will have raise hands on the right hand bottom on the next window. So click on raise hands. Accordingly, we shall unmute. Okay, so the ones who raise hand, we shall take it in an order, right? So the IT team in the backend shall unmute you, right? Just to keep the meeting in decorum, we have muted everyone so that we also have a good bandwidth and the meeting goes smooth, right? So if you've already done, the team at the backend shall unmute you. Yes. Hope you all of you have you raised your hands? Yes, I see a few raised hands. Okay, let's take the first question from Dr. Ismail Mariteri. I request the IT team to kindly unmute Dr. Ismail Mariteri. The question is posed right now.
Yeah, Assalamu alaikum. Thank you very much for arranging such a wonderful session of the international leaders to flatten the curve. And I appreciate Abeer's effort in the from the beginning itself. You had conducted one interview. I think I was a part of it, and I appreciate that. And even now, you are doing a wonderful job. And why don't you present Abeer Group Research Group? Why don't you present a very beautiful Kerala model set all over the world in preventing this coronavirus spread. Why can't you just introduce a Kerala model for preventing this pandemic to these Saudi community? This is my first question. The second question is, since Abeer and the Ministry of Health is well associated, why we can't even make a culture, I mean a demo on how to how to behave in what you call in the shopping scenario? Because even now I found that many of the people in the crowded cities, especially like Sharafia, people are they don't mind at all these social distancing. So if we can provide or prepare some something like some sort of purposeful what you call demonstration of how to go shopping, that'd be very useful. This is my suggestion. Thank you very much for giving me the opportunity. Thank you.
Thank you, Dr. Ismail. Yes, who would like to, Dr. Jemshith?
Yeah, I can obviously take the first part efficiently here. Now, each country or each state has got different population dynamics and different barriers. I'm sure Kerala model was a successful model, lauded across the globe in its efficiency and all that. But I'm sure the questionnaire himself would understand and appreciate that the dynamics in Saudi Arabia are different, with multicultural modalities coming in. The simple thing of contact tracing is much easier in a small state like Kerala. You can directly pinpoint the 10 or 15 contacts. But if a person here goes to a shopping center, it's impossible to trace all the 1,000 people who attended the same shopping center at the same time. So there are limitations, but I'm sure the best practices can always be taken in, and we can do the presentation, and whatever is applicable here can be adopted by the ministry and other organizations as well. The second one is a very good suggestion, and we'll definitely work in collaboration with the MOH to issue maybe visual guidelines itself. But I would also want to inform that there's always the carrot and the stick. So unless the government comes out with the whip and the stick, with imposing fines or not wearing masks and crowding, I don't think people will effectively imbibe it as much. It's like, again, the seatbelt issue. There are rules in place, regulations in place. If you just advise them, there will be less people, a number of takers. But the moment you put a security camera and start charging you, they will start obeying it. I'm sure Ms. Bilquees can also add to this point. Please unmute her.
Yeah. Yeah.
Okay, I have read the Kerala model. I was going through it, and mashallah, they did a very good job. But the point is, that the practices, as you said, in Sharafia or in Bani Malik area, where people don't really like to follow social distancing, and they don't really bother. Well, I'm not sick, I don't need to wear a mask, or they'll put on a mask and then they'll actually pull it down, and they won't even actually wear it properly. So these rules have to be executed by each of the shop owners. All right, I'll tell you my experience. I went into the shop right today. I went into the supermarket, and there was triaging. Okay, there was a single gate. There was triaging. I was screened for my temperature. I made sure that I had my own gloves on. The person in front of me had no gloves. He was given gloves. He was given a mask. He was asked to use the sanitizer. And when he went in forward, they only allowed a few people to go in every time. So if every shop person takes measures to control this, that is how it will be done. Because some people are negligent, some people are not. Basically, I'm sorry to say this, but they don't really care about the person in front of them. But these rules have to be implemented, right? So, and one way of implementing is by imposing fines, as you said, having very strict rules, having very, very strict rules in schools, in businesses, in shops, in restaurants, and these have to be regulated. Once there's strict rules with penalties, everybody will follow. Everybody will follow it. If shop owners are going to allow people to come inside without face masks, without gloves, there you are. You can't actually blame the person as well, because you'll say, well, nobody stopped me. I went into the shop. So every business owner, every shop owner has to be responsible, because he's actually inviting a crowd inside his store, inside his shop, inside the bank, inside the bank services, money exchange people, all right? So they have to take their responsibility as well. And from the health side, they are scrutinized and they are surveyed. They are screened very, very thoroughly and very, very strictly. Any center, any shop, any mall that does not follow these regulations is completely closed down. They are not allowed to remain open. So this is going on. Penalties are being imposed, and Ministry of Health, Amana Jeddah are taking precautions for this. They are keeping a check on who is following the health regulations. But I think, as you said, like those who want to go into business again have to take up the responsibility. There is no restriction on you to, go back full time pledge, but make sure whoever comes in follows the health precautions. Because if you allow them to come in without it, there you are. You've not done your part. This is how you can do it. This is how you just have to regulate it. And I've seen it being regulated, but maybe perhaps in certain areas it's less as compared to the others. In certain areas it's less. And what you were saying earlier of preparing a visual to demonstrate to them, but it would not be easy. I don't think it would be easy for as a field worker to go and talk to people like this, because then you'd have to have a crowd in front of you. And that will not be possible. So I think the best way would be like to have important information, basic information to the point, written out in different languages. So at least they can read about it. Or on social media, okay? Because everybody has a phone. Everybody has a phone in their hands. Everybody is on Snapchat, Twitter, YouTube. So social media messages would be good in different languages. Different consulates can take up this, okay, and send out important brief messages in your own languages so people can read it and understand it. That would be very important, because we're going to have to deal with a very broad community over here. We're not only Arabic speakers over here, we're a huge sector is non-Arabic speaking. Okay, we have the African community, we have the worker community, and each community has to be targeted, I think. Because this is why we are getting a lot of cases also spiked up. I think it's all because of not taking care of social distancing. And the other thing is that not being able to maintain social distancing because of their living accommodation, because of these certain conditions which don't allow them to keep social distancing, as is mentioned, keep a 1 meter distance or a 1.5 meter distance. It's not possible for them to maintain it, so they don't. And you can't blame them. But within that space, if you can advise them to wear face masks, to use a hand sanitizer, to regularly wash your hands, these would help. Even in the conditions that they are living, if they are not able to follow social distancing or keep themselves at bay, at least these personal hygienic measures can be enforced on them.
Thank you. Thank you, Dr. Ms. Bilquees. Thank you, Dr. Jemshith. Hope Dr. Ismail, the answers to your question. Yeah.
Okay, I would like to inform.
We have to take another question, sir. Can I get back to you, because many people raise hands. Okay, please. Yeah, I'll get back to you. Thank you. I call on Mr. Ubaid Edawanna with his question, please.
Yes, sir. I'm here. I'm calling from Riyadh. Okay.
Can I have your video on, please?
Yes.
Keep your mic on at the video as well. Ubaid Edawanna.
Hello. Yes, sir. Assalamu alaikum.
Morning, Islam.
Yeah. On behalf of Riyadh India Media Forum, I appreciate the entire team members who associated such a wonderful session. As a media person, it is my responsibility to share this message to our thousands of viewers. Now I have a quick question to you. Okay. Now, unfortunately, almost all hospitals under MOH and private hospitals, fully occupied and no bed space, okay, available. So what is our plan B in this regards? Shall we encourage the home quarantine? Okay, then what is the security measures we have to implement, especially in bachelor's room, and labor camps? There are so many people inside one room. Okay, 10 people, 15 people staying together. So how we recommend to that?
Yes.
Is it clear?
I think.
Go ahead, Ms. Bilquees.
Yes, Ms. Bilquees, please, you'll have to unmute. Please, I request the IT team to kindly unmute Dr. Ahmed Alungal and Ms. Bilquees, please, the panelist. IT team, please unmute Ms. Bilquees and Dr. Ahmed. Yes, Ms. Bilquees.
You know, the point is that we have to face the fact that we do have a large labor community over here, and their accommodation is different. Of course, they are sharing rooms. There are more than 5 or 6 in a single room, and it's not possible for them to maintain social distancing. And there's a huge sector of labor community. So what I think would be helpful is that the consulates, okay, of these people, where they're coming from, whether they're from African community, African country, or Bangladesh, or India, or Nepal, okay, the consulates can give out important messages, educate them in their own language, that if you're living in the same room and if you don't have enough space, wear a face mask when you're in the room with the same person, regularly wash your hands, keep your personal equipment to yourself, do not spread your clothing, everything everywhere, okay? All right, and when you leave the room, wash your hands. When you come back from outside, wash your hands. If you feel any symptoms like a runny nose, a cough, if you feel tired, you have fever, then you should immediately inform your supervisor, okay? Don't grab a paracetamol or something. Inform your supervisor that you're feeling sick, all right? So that your supervisor can make some arrangements to at least put you in a separate room. At that time, you must make sure that everybody in the room does follow all the hygienic precautions. All hygienic precautions should be followed, because it's not possible to shift all the labor community into single rooms. It's not possible, right? We can't do that. So, but this practicing proper hygiene, educating them, you need to educate them. All right, they have to be educated. Now, I've spoken to, during contact tracing, I spoke to few of the people who were non-Arabic speakers, and they didn't have much idea, that how can I protect myself? And some of them, some of them were told that no, Ministry of Health did come to us, and we were given sanitizers, we were given face masks, and we were told, that whenever you enter or exit the room, wash your hands, do not go and touch other people's things, keep yourselves to your personal belongings to yourself, so try and not sit in crowded areas. If somebody is sick, coughing, do not go and sit next to him. These are few points that can be written down in their own language, all right, and then passed out to them, passed out to the supervisors so they can distribute it among the labor community, that please read these, please follow this, and they should make provision for sanitizers, for face masks, for gloves to be provided to them.
Right.
Yes, thank you, Dr. Bilquees. Yes, Dr. Ahmed.
What Dr. Bilquees enlightened us. Now, what Mr. Ubaid Edawanna just shared with us, we had been getting a lot of queries in the same regard. Just to make the situation clear on the ground. So what happens is, now if a case is positive, the cases are now, the patients are now shifted to a private hospital or an MOH facility based on the criticality. Because nowadays what we're seeing is there are a lot of asymptomatic carriers who have absolutely no symptoms. They're perfectly fine, just that they might have had some positive. So we give, when we call the patient, once the report is ready, we call the patients and we list them out according to the priority of their symptoms. So whoever is more critical, we get them in first. So that way, the general idea is now everyone panics. Once you get a call saying that you're positive, then they make it a point that they have to get to a hospital immediately. But what we want you to communicate to the people are that every hospital is getting in patients, because there is a continuous loop that is going on. Once if the patient was tested positive in a private facility, we bring them to the private facility. From here, we communicate to the MOH, and then we ship them to the MOH. This is a continued process that is happening throughout the day. Even in midnight, these transfers are happening. So again, as I said here, the criticality is what we prioritize here. So as and when the beds come vacant, we've shut them. So nowadays, what we're seeing is we had a hiccup in the last few weeks in Jeddah. This is almost entirely solved now. I can say almost entirely solved now. There are very few cases that are positive and are staying at home in Jeddah. The same will be happening in Riyadh also, because now we saw a spike in Riyadh in the coming few days. But it will be clear. Because MOH is not just confining to hospitals. They are taking in hotels and furnished apartments and all, and giving all facilities to the people. Also, There are companies that have employees in big numbers. The companies themselves have been mandated by the MOH to get an accommodation and shift their cases to these facilities where MOH or accredited hospitals are providing medical support. So right now you don't have to worry. There are available. So what I intend to say is, there is, as of now, there is no shortage of beds. There are beds available. It's just a process of time with the prioritization that is happening. Because we, as you always know, we have a triaging system. Person who is very critical will be taken in first. That's the only process that is happening. So I hope it was clear.
Thank you, Dr. Ahmed. Hope your question's been answered, Mr. Ubaid Irwana. Before I move on to the next question, there is a message it's been sent by Dr. Ismail Mirteri from GGI, Goodwill Global Initiative. What we have done as a social responsibility, Abeer has joined with community organization like GGI to provide our best services. So we have set up a response team, emergency response team of 2 doctors, which will be available round the clock. In fact, there's a certain time also that we can call in to these 2 doctors. That is between 7:30 and 9:30 in the evening. So there are these 2 mobile numbers, which is directly going to these doctors. If you have any queries or any support that you would need, you can get in touch with them. It's an initiative that we, Abeer Medical Group, in association with the Goodwill Global Initiative, has taken further. Similar initiatives can be done with other major organizations as well. You can get in touch with us. We are more than happy to support any and every organization with any community. Okay, now moving on to the next question. We have one Mr. Okay, here we go. Let me just quickly see. Okay, his name is Mustafa Khan from Indian Engineers Forum. I request the IT team. Yeah, thank you. Mustafa Khan, please, your question.
Assalamu alaikum rahmatullahi barakatuh. Very nice lecture and information. So the compliments are there. Just to save time, I'll come directly to the question.
Please.
And that will be a practical way how we can do the prevention of it. Because we are getting many solutions and things like that. And needless to repeat that in Jeddah, we are living in a metropolitan city of multinationals, multilingual and all these facts. So one formula will not work, one language will not work, and team will not work. Once again, the slogan, we are all responsible, is more appropriate. But from the medical side, we need a line of action. What will be the preventive measures? And accordingly, each community people can try to adapt into their local people and influence. Labor camps is a different story. Some bachelors staying in the city is a different story. And people staying with families where the ages are more than 50 and 60 with kids and families and women and all that. So practical steps for prevention, if something as a sequence, if you have in your mind, I will prefer to listen to it. Thank you very much.
Yes, Dr. Jemshith.
Yeah, so thank you for the question. I think, as you rightly said, there is no single answer to the problem that you just mentioned, that it has to be customized, tailor-made to the community, the living standards, the education levels, maybe the place they are in. So all these matters. But, you know, the major impact or the most effective measures, as we have discussed and we have been discussing, is your personal hygiene measures and distancing measures. These are the preventive measures, I could say that way. If you are asking me, is there any food or a habit to take to prevent? Unfortunately, there's no scientific evidence that any of the, I can see anything in the supermarket, all comes with the tagline. I've had people call me and saying that, doctor, I have fever, but I'm drinking garlic water. Is that okay for me? So people come up with their own local cuisines and local anecdotes for these, but unfortunately, there's no WHO proven simple cure or a preventive measure other than hand washing and safe distancing. So you cannot eat ginger all throughout the day and go to a positive person. That doesn't guarantee you from getting it. So wearing masks, safe distancing practices, hygiene practices, I think these should be. And distancing would be customized according to the place. So labor camps have a different viewpoint. Now, regarding isolation rooms, I had some of the community members, you know, they have community schools. So some of them are treating these community schools where it's all empty now to rehabilitate some of the isolation required people. So they're doing that on the community level. So this can be one solution for labor camps. I'm sure it's not practical to shift everybody, but whoever is symptomatic or something, at least 1/10 of it can be shifted this way wherever possible. So that could be one guideline. Thank you.
Thank you, Dr. Jemshith. We shall move on to the next question. We've got quite a few questions and time is short, so I quickly, without further ado, I'll move on to the questions. Let's take up as many questions as possible. One from Mr. Memon A. Khader. Request the ITT. Yeah.
Yeah. Okay.
Yes, Mr. Memon, please.
Yeah, can you hear me?
Yes, we can. You can straight away get into the question.
Yeah. See, as far as I have concluded that there is not much of information in the society, even among the educated people, and there's a lot of confusion going on. I have few questions to Dr. Bilquees, that since there is no vaccine, these people who are getting admitted, they are being treated with HIV medicines and other medicines which are not at all for this COVID-19. And COVID-19 as such have no particular treatment till now. We have, as you said, the vaccine will come in 1 year, 1.5 years. I don't know when it will come. Anyway, so I like to hear from you that first of all, can you give a short introduction of this virus? Is it airborne, or is it only contacted by people coming in social distancing? As far as other aspect is concerned, we hear from the most educated people, the most powerful people, like Mr. Trump in America, saying that I don't want to wear a mask. He had refused to wear a mask and is not wearing a mask. Okay. This gives another perspective that highly educated, most powerful nation president is saying this. Then there are some others who believe in clapping and lighting the candles, which is again taking it somewhere else. On the third front, I find there is one on YouTube, there is one Dr. Swaroop.com. If you hear his video, you will get a lot of enlightenment about COVID. I had been hearing his video, and his videos are on and off removed from YouTube. He says there is no virus. This is only a fear put in the people, and due to wrong medication, people are dying, and they are being given HIV medicines. That's the reason they can't fight with the immune system, or the elderly like me. I am worried at my age, more than 65 now. So these are the questions I address to you, and I hope that you will enjoy my questions and give me a free answer.
Thank you. Now look, I want to tell you something. Each one of us is responsible for our own self, okay? Don't go in and watch a lot of media, please. People are lighting candles, yes, but you can yourself think logically, is it going to help or not? There is a virus out there. It is diagnosed from the family of coronavirus. It is spread through droplet infection. This is why we tell everybody to practice proper hygiene when coughing or sneezing. We ask you to maintain social distancing. Why? Because it's airborne. It can remain in air for some time. So if you're very close to the person, those droplets can fall on you. And if they enter the mucous area, then you can get infected. Either you will be asymptomatic depending upon your immune system, or you'll develop the symptoms. So do not follow a lot of social media content which sounds illogical. Please ignore it, okay? And it's always a good idea to follow either WHO or CDC, or you can log into the CDC of KSA, all right, to have the latest information and accurate information. WHO has actually gone ahead and given out myth busters, okay, of people drinking garlic, eating garlic, or drinking a ginger tea, everything. I had a lot of messages coming on my WhatsApp group. There was a very funny message that, the virus is acidic, and so we need to start taking alkaline products. And they listed the alkaline products, and all of them were acidic itself. So I don't know, there are a bunch of people sitting very free and they like to play with all these messages and play with our minds. You have to be responsible for your own self. Open up the net. If you like to read, if you like to go on the net, open up WHO, open up CDC, open up KSA CDC, all right? And read the information, get the accurate information. Now, if somebody doesn't want to wear a mask, then he's responsible for his own self, right? Just maintain distance from that person. Nobody is asking you to go and stand next to him. You can't control the trillion million people in this world. You can't have them all behave the same way. People will always think out of the box. There is no virus, and the thing that people are being treated with HIV medication actually reduces the HIV viral load and boosts the immune system. Now, I specifically work in the HIV program, okay? And one of our aims was to quickly refer all the newly diagnosed cases to the treatment center and get them on treatment so their immune system, which could be compromised, you know, can have at least some support. So HIV medications are not being used for this. Yes, malaria medication was announced that, yes, go ahead. But immediately FDA and WHO said there is no proof that this chloroquine medication will work, okay? So they're trying it. People who want to try it, they're trying it. Can you stop them? No. But you can think for your own self, decide what is right and what is wrong, what makes sense. Okay, decide what makes sense. If somebody tells you there is no virus, then how are these people dying? Coronavirus family does exist. Sit and open up a microbiology book and you'll actually find the entire family of coronaviruses over there, you know, with pictures, everything, and different strains coming up. So there is a lot of medical information available, but you have to access the right site. Read about it. If you're very interested in the minute details, go in details. You'll find the actual minute details about the virus itself. Okay.
The lockdown, we are doing that only.
Please do not open up a lot of social media, YouTube videos. You know, it doesn't help us. It actually scares us and actually confuses us. So
thank you. Thank you. Appreciate it. Thank you very much.
WHO is a good site to follow.
Thank you, Doctor. Thank you, Doctor.
Thank you.
Dr. Jemshith, I would like to reiterate one point which Doctor mentioned, the COVID fact check point, where we have doctors initially mentioned in his presentation about the initiative that Abeer has done, a concept, it's called COVID fact check. We have a WhatsApp number that we will share with you at the end of the presentation through WhatsApp, and you can get back to us whenever you are in doubt. You want to cross-check, yes, we shall share a common number. We will get back to you with the right facts with regard to COVID. And
so, I'm sorry, I'd like to know, how are you propagating this message that you've actually opened a hotline or a number? How will people from different communities know that they can actually access Abeer if they have a doubt, if they have a confusion? How are you going to relay this message?
It's a valid point. See, in today's day and time with social media, we are soon launching a campaign, okay, on the importance of using masks, and we already launched a campaign called Beat COVID is a concept. So that's a concept which will be propagated through the social media platforms.
Social media, and you'll have all the numbers out that if there's a confusion, you can ask the panel, you can get authentic information, because as I know, a huge community looks towards Abeer for treatment. MashaAllah, I know that. So all these people will be looking more forward. You know, you have your favorite doctors and your favorite physicians, so you want to hear from them. So it would be very helpful, even in your clinics, if you have these messages being on a screen board or something that, you know, you have a doubt, contact this number, you know, it would be helpful. It would be good.
Well, great. So these are initiatives that we will soon announce, and we will be hand in glove with the community as a social responsibility. Thank you so much.
That would be good. I hope the other consulates will also do something like this, you know.
Yes,
I really hope the consulates will do something as well. That would be a big help.
Absolutely, absolutely. Thank you so much. And then moving on to the next question, can we call on Mr. Nasir Khurshid for this question, please? Mr. Nasir, your question, please.
Yes.
Otherwise, we'll have to move on.
Hello, assalamu alaikum.
Yes.
Can you hear me?
Yes, please.
Yes, I can hear you.
Yeah. First of all, I would like to thank Dr. Ahmed Alungal, Dr. Bilquees, Dr. Jemshith, Abdul Rahman, and Zaki for this great initiative. Really, it was wonderful listening the presentation from Dr. Jemshith and even from Dr. Bilquees too.
Yes, sir, please
My
get into
question
questions,
is,
sir. Yeah. Thank you.
actually, I was expecting some random tests here in Jeddah or in Kingdom. This might have been initiated by Ministry of Health or hospitals like Abeer. Do you have any plan for that? This is my one question. Second question is, because nowadays, as far as our Indian community is concerned, lot of people, they lost their jobs, and most of them have do not have the insurance also, because once they lose the job, the insurance will not be renewed. In such cases, what action is taken by hospital like Abeer to treat the people? Not, I am not concerned about the COVID or this corona in general, because medical facilities what you are going to provide. So in this way, one suggestion, small suggestion I want to connect with this one is, if somebody has the whatever the insurance card, the conditions what apply when it is valid, same can be continued to treat them, because they should not be suffered because of losing the job and again not renewing the insurance. So this is my two questions. If panel can answer.
Please limit to one question, please. We're short of time. Yes, yes, from the panelist, Dr. Ahmed, Dr. Jemshith would like to answer this.
Dr. Ahmed can take the question, please.
Regarding the testing part, I think Dr. Bilquees would be the best person to answer. Regarding the
random testing is being done. Okay, testing is being done in the labor camps also. We have an active field group that is responsible purely for going into different areas, you know, the heavily crowded areas. Hindawiya, there's Gulel, there's Gueza. They do head out and they do screening. So they are screening every day. One reason why you're having a spike in the number of cases is because of the number of screening tests that are being done. It's being done at a very big level. It's being done at a very big level. Don't worry about that. It's being done in different areas. It's being done in areas like the hot target areas on the road, people down walking on the road, or people living in the houses, in the labor camps specifically. Okay, it's being done. Screening is being done.
So only labor camps are concentrated, not the areas.
No, in the area, look, there are a lot of volunteers who have joined also in this, and they go area by area, okay? Because Jeddah is not a small city, so everything cannot be covered in a day, all right? But as far as I know, they are doing it every day. People from my own department also who are working specifically in HIV are enrolled in the active surveillance team, and they are the ones who head out every day. An area is picked up where we're getting cases. How we find out about the cases is through our electronic system. When we get reports from different hospitals that we have these many suspected cases, the area to get these notifications is selected that, okay, from this area, we're getting a lot of suspected cases. That area is then targeted for screening. So eventually, and I hope the screening will increase eventually, you know, but that is going on. It is in place. It is in place, the screening.
Thank you, Dr. Bilquees. Thank you, Mr. Khurshid. Well, see, we're having a lot of questions coming in, and we're short of time. I'm sure we just help people beyond time now. I've got more than 10 questions here, but I may not be able to answer them right now on live. But you can take down this number, which is going to be our hotline WhatsApp number, which is, please take it down, 055 052 1795. I repeat, 055 052 1795. It is a number. This is a number for COVID fact check. This is a number for any queries that you have. You can WhatsApp it to us. Right now, I move on. With this, I'll have to come to the end of the Q&A session. Thank you so much for the.
Thank you.
But we move on to the next speaker, and most importantly, our president. I request Mr. Alungal Mohammed to kindly address the gathering, please. President Abeer Medical Group, Mr. Alungal Mohammed.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thanks for all the. You know, we have to be thankful to the government of Saudi Arabia for their wonderful job. The whole mission is now engaged in the
corona virus control. This is a great job doing by the government under the King Salman bin Abdulaziz and the Crown Prince Mohammed bin Salman, and of course the Health Ministry of Saudi Arabia. We can say that we are in a very safe zone comparing to any other country. Our responsibilities today is to communicate the society how to behave with this virus. We are in a laboratory now. We don't know when the result comes. So we have to be patient and we have to control ourselves to not get from others and not to give to others from our side. Message we have to keep to our community. Only my message to our leaders. Not panic. We are in a very safe zone now. Just control ourselves and give the right message in the right time to our society to not take this virus. That's only. This is the message I want to give. Otherwise, I think we are getting all sort of service. One is financially supporting, where there is if there is no food, government is giving food, supporting to the business community. Everything is there. Only ourselves we have to try to not increase this. Every one of us have a role in controlling this pandemic. This is the only short message I would like to give in this time. And thanks to all the participants. And we need these leaders who joined this conference today to take this forward and to involve themselves to control their own society. Every leader have their own society. Through them, give the message to the public how to control themselves. Where they need to wear the mask, they have to wear the mask. Where they need to wash the hand, they have to wash the hands. This is the only precautions we have to take today. The medicine, vaccine, all it is coming. I think before coming that, if we control ourselves, we can control this pandemic easily. Assalamu alaikum wa rahmatullah.
Thank you, sir. Thank you very much for the lovely talk to all the leaders. So everybody has a responsibility towards the society, and it's time for us to act and prevent. Prevention is always better than cure, as always said. And this is the time for us to educate the community and keep the community at bay from this pandemic. Up next, our next speaker, I request one of the most eminent personalities Kingdom of Saudi Arabia is known, a very eminent media personality, a veteran in this field. I request Mr. Khaled Al Maeena for his closing remarks, please.
Well, how are you?
Welcome.
First of all, I'd really like to commend Abeer. I know my witness for this is in good judgment because I'm from the Abeer family. But what you truly have done, and I look at it from outside as somebody with doing a surgical incision, it's a great thing the community has to know. Bilquees, or Dr. Bilquees Khan, also gave some good points. Now, what we have to do is we have to relate to people, as Mr. Alungal said, to people. People are out, they're not wearing the masks and all. I heard this morning that the government was going to fine people once they open it after 31st. Anyone not having a mask would be fined 100 riyals. But what has been done today, in all honesty, and I say it, alhamdulillah, is a great step. I wish more would come out because everybody contributed. I think hospitals, we may be small, not in the big screen, but I can truly tell you that Abeer is a leader in innovation. And inshallah, we will see more of these. And I would like to thank Dr. Jemshith, Ahmed, you, Abdurrahman, of course, Mr. and others for having done this. But it's true, unless we get the message to the labor camps, to others, I move around, 90% of people are not wearing masks. You go to Sharafiya, Shara 16, Majid and all, everybody is walking as if it's just Christmas Day. So it's important for us that in Abeer also, we will be able to get messages through social media. I enjoyed every moment of it. And I was hiding behind my but I listened very surreptitiously to each and every word that was said. Thank you very much.
Thank you, sir. Thank you very much for your valuable thoughts on today's session. Before we end today's session, I would like to thank each and every leader, a community leader. Everyone has their own responsibility towards their own communities. This is the time to act. This is the time to safeguard your community. Thank you so much, members from all the communities, from different nations we had, as I said in the beginning, from Philippines, from Ethiopia, from Sudan, and other countries as well who joined us today, apart from India. And of course, members from the media fraternity, from Jeddah and Riyadh and other places who also joined us, and from various other organizations. Thank you very much for joining us. And also, last but not the least, to Mr. Ghaznafar Ali Zaki for having helped us to reach out to most of you community leaders with his contacts. Thank you very much. A short time to help us reach out to the community leaders. And also, of course, the IT team who's been working tirelessly to make this event successful. Thank you to the speakers, Dr. Jemshith Ahmed, Dr. Ahmed Alungal, and Dr. Bilquees. Thank you very much for gracing this occasion, madam. It was a great pleasure having you with us this IT team, will have to unmute Dr. Bilquees. IT team, please unmute Dr. Bilquees. Just a second. We want to hear you. We will. I just, there's some technical issues. Yes, please.
I'm sorry to interrupt you. I just wanted to thank you so much. This is a very good initiative and a very active initiative taken by your side. I hope the other health sectors, I mean, the other parts of the health sectors also take an initiative like this. And I wish you all the best. And anytime you need us to join in, you just have to call us out, okay? And as the President Bray rightly mentioned, that we want to take care of ourselves and also of the person in front of us, because he's part of our community. Okay, because if you're part of a community, don't just look for yourself, look for the person, the other person in front of you, next to you as well. Thank you so much for inviting us in here.
Thank you, Dr. Bilquees. Thank you very much. So please feel free to get back to us, get in touch with us on the WhatsApp number, or you may contact any of us directly. We are more than happy to associate with the community, engage with the community, and educate the community to keep this pandemic at bay. With this, your host for the day, Abdul Rahman, signing off with a smile. Have a nice day and wish you all an Eid Mubarak in advance. Thank you so much.
Thank you. Thank you.